Welcome to EMDR, the science behind the therapy, a podcast from the Sonoma Psychotherapy Training Institute. I'm your host, Dr. Andrew Leeds. In each episode, we explore the latest research and clinical insights about EMDR therapy, highlighting the leading scholars' latest contributions to EMDR research, education, and training. Whether you're a therapist, a student, or a lifelong learner, I'm here to connect you to the science behind the practice of this remarkable form of psychotherapy. In episode 13 of EMDR, The Science Behind the Therapy, the episode title is From Qualitative Insights to Meta-Analyses, EMDR Therapy at the Frontiers of Trauma Research. There are 20 new studies summarized in this episode. To cover them all, a few will receive in-depth coverage, and many will be covered with an abbreviated summary. Keep in mind that nearly all these studies are open access. They are listed with direct links to their publishers' websites in the August 2026 blog listing of references. Episode 13 opens with 3 qualitative studies. Qualitative studies are a less common and a challenging form of research, which often yields important insights. The first of 3 qualitative studies from Germany investigated how clinicians determine set duration during reprocessing. Then there was an Italian report on the legal admissibility of courtroom testimony by children and teens after EMDR therapy. And finally, there is a report on successful reprocessing beyond symptom resolution on patients' sense of self and their worldview. Then we look at a randomized clinical trial in which a simplified version of eye movement desensitization was delivered by graduate students in China, comparing EMD with imagery rescripting for trauma resolution. This is followed by 3 meta-analyses. The first is a massive analysis of 55 studies of non-pharmacological interventions for trauma. The second examines dropout rates in various forms of manualized trauma treatment. And the third explores treatment effectiveness with disaster survivors. Then we turn to the role of fidelity rating with an international study on the use of the DePrend EMDR protocol for major depressive disorder conducted in a low-resource Pakistani setting. Then we will explore a series of 10 review articles covering a wide range of research designs and topics. Then some brief reports, such as a feasibility study of EMDR for teens with anorexia, and a clinical instruction article on working with non-binary and transgender EMDR clients. The episode closes with a summary of a major critique of the 2025 American Psychological Association Clinical Practice Guideline for PTSD in Adults, written by Chris Lee, Adu Jung, Derek Farrell, Larissa Meinzer, Sarah Dominguez, and Sharif El-Lethi in the Journal of EMDR Practice and Research. You won't want to miss their incisive critique of APA's flawed guidelines, which is so out of step with all the national and international treatment guidelines for treating PTSD. To access any of the original research papers mentioned in the podcast, there is a complete list of references and links in the research blog on sonomapti.com. A link to these references can be found in the show notes. I invite you to turn to the full version of episode 13 of EMDR, The Science Behind the Therapy, titled From Qualitative Insights to Meta-Analyses, EMDR Therapy at the Frontiers of Trauma Research.